Hi, I'm Dr. Amy Witman, and I would love to tell you about my practice. I am a San Diego native, born and raised here. I then went to suburban Philadelphia, where I went to college at Bryn Mawr College, and then I went to Medical College, Pennsylvania. Came back to California to do my residency at Loma Linda, which was an amazing experience. After I finished my training, I went to work in a small town in the middle of nowhere in New Mexico called Hobbs, and worked there for 3 years repaying my student loans, and then have come back long-term here to be back at home in San Diego since 1998. When I first came to town, I went to work for Scripps Clinic, which was amazing, and I worked there for 20 years. I am Scripps affiliated now in this current practice. Because I spent 20 years at Scripps, I still have a lot of connections and ties there. That allows me to have full access to Epic, which is the electronic records that Scripps uses. I can see all of those records and I can put orders in. I can send messages to all of the Scripps doctors. I still refer patients to private practice physicians and physicians in other health systems like Sharp and UCSD. I'm just not quite as familiar with their systems. So if there's a specific physician that you're looking for, I can absolutely make that happen. I still have lots of friends there and still get all my care at Scripps. But what I learned over time was that the big healthcare systems, these large multi-specialty groups, they're hard to work for, and it sort of felt like drinking from a fire hose every day. I really felt like the visits were too short and I was pushed. So I was lucky enough in 2018 to take over a practice of a colleague who was looking to retire. We worked together 2018 and 19, and then it's been just me since 2020. This practice is a concierge type practice. And I say it's a concierge type as opposed to the traditional concierge model because there are some differences to it. Traditional concierge practices, there's an upfront fee that in this region can run about $5,000 or $6,000. And then when you go to the doctor, they use your insurance to cover the visits and so forth. This practice is different in that we don't have an annual fee. That allows people to be able to get into a concierge kind of experience without the big upfront fee. And basically you just pay for services as you go. My practice is completely outside insurance, so I am out of network for all insurance, including Medicare. So patients just pay for the visits that they need and pay for the care as they go, kind of like you might pay an accountant or an attorney. The vast majority of my patients have insurance, and that insurance is used for things like labs and x-rays, seeing specialists, having procedures, going to the hospital. The only piece that goes outside the insurance is the time with me and my staff in the office. The advantage to that, like I said, is that you can get into a concierge experience without that big upfront fee. It still has all the benefits of a concierge experience. The practice is small, the visits are longer. A typical new patient visit or an annual physical is an hour. A typical return visit is about half an hour. So it has that access that you're looking for. We usually can see patients the same day or the next day occasionally. Often, if I'm not with the patient and you call the office, I can get on the phone. I do take all of my own call, and so if you need help after hours, you get me. Because it is just me, I encourage folks to call if there's an urgent issue, but if it can wait to the next business day, then I encourage them to leave us a message or give us a call the next day. I was in this practice as a solo practice from 2020 through the beginning of 2025. Then my partner unfortunately got sick in January, and I called an old friend and colleague, Dr. Ilya Christie, and she came and has been working with me ever since. She works 2 days a week and I work 3 days a week, and we see ourselves as sort of interchangeable. We actually job shared at Scripps for 10 years together, so we know each other well. We have similar bedside manner, similar medical practice styles, and so we really sort of see ourselves as one entity. Patients can choose to see one or the other of us. Most patients actually see both of us, depending upon what their needs are as far as appointments. I'm really enjoying this practice because it allows me the time to be able to spend with patients, to practice medicine like I think it should be, rather than being rushed and hurried. So patients get the care they need. I get to practice medicine the way that I enjoy.